My name is Dr. Faizan Aziz. I'm a consultant interventional pulmonologist at Virinchi Hospitals, Hyderabad. 24th of March every year is widely celebrated as the World TB Day or the World Tuberculosis Day. So today I am here to give you a brief insight on tuberculosis. India is called the land of TB. In India, TB exists on a massive scale. It's our global health problem. Every minute, one person dies of tuberculosis in India. Just imagine, it's a very grim statistic. TB every year costs India more than $24 billion, something which a poor country cannot afford. So let me give you a brief talk on what exactly is tuberculosis. Tuberculosis can happen to anybody, anywhere. Any person with low on immunity, low BMI, malnourished, can be contracted with TB. Patients who are post-transplant, long-standing diabetics, long-standing health ailments can contract TB. TB is in the air in India. Most people consider TB to be a disease which is only confined to the lung, which is not the case. In fact, more than 50% of cases of tuberculosis are outside the lung, which are extrapulmonary as what we call in our medical term. It can be in the form of fluid in your lungs. It can be in your brain, a brain TB. It can affect your heart. It can affect your bone. In young women, it can be a cause of infertility, wherein it affects genitals, ovarian, uterine TB. So you name it, you have it. TB can affect any part of the body. Now coming to symptoms of TB. In case if TB is lung bound, if it is a lung infection as a pulmonary TB, what are the symptoms that a patient has? Routine cough. He might cough up blood, there might be weight loss, there is loss of appetite, night sweats, a feeling of being unwell. In cases, as I mentioned, where TB is outside the lung, it can manifest as swelling in your neck, in your axilla, somewhere in your abdomen. You have a swelling, which is an inflammation of a lymph node. So it can be felt as a lymph nodal swelling anywhere in your body, which obviously has to be diagnosed, but can be a form of TB. So coming to the treatment of TB. Treatment of TB is a prolonged treatment for a period of 6 months. For simple case of TB, 4 drugs given for 6 months, you are out of it, provided the patient adheres to the treatment, provided the patient has routine follow-ups. But as the treatment is a prolonged treatment for a period of 6 months or more in a few cases, patients do not adhere to the treatment. They don't follow up with the treatment, they discontinue the drugs, as a result of which TB gets mutated into a severe form of TB, which is the multi-drug resistant or an extensively drug resistant TB, wherein the drugs given for treatment of simple tuberculosis do not work. So obviously you have to add more medications. The prognosis is bad, it can be fatal, it can definitely take your life. So diagnosis, evaluation, follow-up of TB patients is mandatory. Patients, what I feel, also have stigma of disclosing this disease. Yes, in case of pulmonary TB, it is contagious, but in cases of extrapulmonary TB, the disease does not spread. Timely diagnosis and evaluation for a healthy recovery is important. So let's pledge on this World TB Day that you and me will fight against tuberculosis, protect ourselves and our loved ones from this deadly disease. Thank you.